Welcome back to my channel. I've got a real doozy for you guys today. So, excuse the cold sore. I have a cold sore down here. I don't know if you guys can actually see it, but I was like, I can't wait to make this. I think I'm losing my voice too, but something went viral on Twitter that has a lot of us losing our minds. And it is this video of this influencer or a podcaster. I don't even know who she is. Never seen her before, never heard of her before. And so I follow this guy. He's a toxicologist who I find him a bit problematic as well, but he shared the video. And I'm going to play it for you guys. I don't know if you'll be able to see it, but you'll probably be able to hear it, which is the important part. It is absurd.
Heart, and it is for the most deeply spiritual people on the planet.
I'm trying to rewind it here because it is.
Yes. I worked with a medical intuitive, and she said every time she sees someone with Lyme, it's an intergalactic substance, and it's literally bringing in codes from the beginning of time. Yes. I know. I believe this. This gives me chills down my entire body. Yeah. I believe it. Yeah. I haven't heard it in those exact words before, but I'm often trying to say the exact same thing. Yeah. Lyme is a gift. Yes, yes. It is not for the faint of heart. No. And it is for the most deeply spiritual people on the planet. Yes.
Okay, so she's stupid. So this video, I hope you guys were able to hear it. I know that there was a glare from the window. So basically she's talking to an astrologer. We all know about astrology. I don't need to get into that. I don't know who this girl is. I don't know who either one of them is. The astrologer, the lady with the dark hair, her name is Danielle Page. I don't know the name of the blonde girl. But apparently she's some kind of influencer podcaster, I guess. I don't know if she has Lyme. At first I thought maybe she had Lyme disease and that's why she was speaking from her own experience, which, would still have made her statements very stupid, but at least I would have said, well, maybe she's had some kind of positive experience out of it, which would still be very hard to believe. But I don't know. I don't know what her background is. I don't know what they were talking about or how that came up in their discussion. But this clip went viral on Twitter just, I think, yesterday. Yesterday was August 2nd. I don't know when I'll be uploading this video. I'm going to try to upload it soon because this is so ridiculous. She said, Lyme is a gift. It's for the deeply spiritual. It's an intergalactic substance, which that is, a lot of these people are just so out of their minds, astrologers. They're probably mentally ill, to be honest. They probably have some kind of, because I feel like I've known people that have serious mental health problems. My ex-husband had ADD, really severe ADHD, and he was kind of into all of that kind of stuff. He had some coworkers that were also kind of weird, and they were all into that kind of stuff. So I don't know. I do think that it's kind of a byproduct of just being so out of touch with reality that you don't even know what you're talking about. But this does not surprise me, and I'm going to tell you guys why. And I may have touched on this topic in my other videos. I don't know. I can't remember. I've made so many different videos. But there is, and I'm going to be specific to the Lyme community because there's lots of different communities. There's the autism community, and I know that there's a lot of, weird stuff and fringe treatments that are shared in those groups. But Lyme disease is one of those communities where there's just so much wackiness thrown in with, fringe treatments, chiropractors that treat Lyme disease, but then there are also legit doctors, Lyme literate physicians, other doctors that don't consider themselves Lyme literate, but will treat, they're MDs that treat Lyme disease. So there's a whole mess of stuff within the Lyme disease community. But one thing that I've learned, I've gone to a couple of support group meetings. I've spoken with some people with Lyme disease on the phone or in person. And I actually have another video that will be going up where I talk about mental illness and chronic illness. And I talk about some of these people that I have met in person or online through, Facebook groups and things like that. And one of the things about the Lyme disease community, um, you know, that I have seen is that it does operate a bit like a cult. And I know a lot of people are going to get mad at me for saying this, and I know a lot of people are going to be offended. I'm sorry that you're offended, but that is one thing that I have noticed. And it's becoming more and more cult-like, where there is just one set of thinking within the group, and if you don't adhere to those beliefs, you're sort of pushed to the side. And I'm going to tell you what I mean here. So, and this is not just, the support groups and things like that. I've seen this with the organizations like ILADS, and a lot of the doctors that are Lyme literate physicians. There's an in group and there's an out group. The in group are the patients that respond to antibiotic therapy, herbal therapies, or some of these other kind of fringy treatments, Rife machines, bee venom therapy, these types of, I guess, alternative or homeopathic treatments, or even just antibiotics, right? That's the standard treatment. Sometimes people have to be on them for a long time, but they respond and they do well on them. And so that has become, the in group, because that's what a lot of, the ILADS organization, it's called International Lyme and Associated Diseases Association. The sun is kind of going in and out, so the lighting may change a little bit here. And they argue, of course, that Lyme disease can be treated with antibiotics, but it may take months. It can even take over a year, a long time. But that Lyme is a persistent infection, and it should be treated with antibiotics. A lot of that thinking has changed, and I think a lot of the science behind that has changed, because for a lot of us, antibiotics didn't do it. Immunotherapy might help and enhancing or modulating the immune system. So there's other things that are going on that are showing that may not be necessarily true for everyone. Of course, traditional Western medicine and the Infectious Disease Society of America says it's 30 days of doxycycline and you're fine. Anything after that is just either mental illness or some other kind of problem. They're also not correct, right? So you have these two groups that are fighting against each other, and they've created this in group and out group. The in group is people that respond to antibiotics. Everyone else can go to hell, basically. And that starts to trickle down to the patients. And I've seen that when I've gone to support groups. When you say that you didn't respond to antibiotic therapy, they're just like, oh, did you try this other thing? And did you do this other thing? And you have to prep your body for antibiotics, and you have to do this, that, and the other. And you have to do hyperbarics and ozone and blah, 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 all this other kind of crap. And so it becomes this sort of tribalism. And it's becoming, like I said, it's becoming a cult. And there are a lot of people that do respond to antibiotics. There are people that respond to bee sting therapy. There are people that respond to, I don't know, herbal stuff. And so they think, well, you just have to do this other thing, right? And so those of us that have done everything, or that can't do everything because we'll react to it, are sort of pushed to the side. And I started noticing that not just with other patients, but with doctors. They kind of don't even want to talk to you anymore when things, don't go the same way as it did for them. A lot of these people bond and congregate over their illness and over the treatments that they've tried. And so they, like I said, they create these little tribes. People that respond to herbal stuff are over here. People that respond to antibiotics are over here. People that respond to other weird stuff over here. And it's just, I feel like it's just getting worse and worse, especially because now we have Facebook groups and, forums and all that kind of stuff. You go and you find the people that responded to the same thing you did. So it creates this what is it called? Sort of this false sense that is a therapy that works, that is the cure, and that's the treatment for Lyme disease. So that's, and then, you do have people like this, people that are, it's a spiritual experience. And the tough part with Lyme disease is that we are all at different levels. Sometimes we're at different stages of the disease, but I think for most of us, we are affected differently by it. It's almost like a fingerprint. Everybody is affected by it differently. I am not like any other patient that I have known. And I've met maybe one or two other patients that have been so treatment resistant that there's basically nothing that helps us. And then there are other patients. There's this one girl that I used to see. I think I used to follow her on Facebook or something. I don't know. And she was like going out, clubbing, drinking, but she had Lyme disease. And I was just like, I mean, at a certain point, I was able to do that as well before I even knew I had it. But, you know, people tend to assume that the way that they manifest the illness is like the worst way that it affects people. And so there's a lack of self-awareness within the community. And I think that's what's driving a lot of this nonsense that we see online. Then you have doctors that are exploiting it, right? There's a lot of chiropractors that love to treat Lyme disease. And let me tell you, a chiropractor has zero qualifications to treat Lyme disease. I will tell you that right now. Chiropractors, acupuncturists, naturopaths, dietitians, they don't have the training, they don't have the knowledge to be treating this. And they're promoting their snake oil supplements or treatments, and they're making money off of it. And I've talked about that in I think a couple of other videos. People also form their identities around it. So this girl that I was talking about that would go out clubbing, I think she tried bee sting therapy and it worked. So suddenly she's calling herself like the queen of bees, and she changes her whole identity because bee sting therapy worked for her. And it becomes this, like I said, this cultish type of thing where it's like, oh, well, this helped me. So now I'm the queen of bees, and, I'm an advocate. I'm a whatever for bee sting therapy. And it just, if I did bee sting therapy, I'd probably die. The other thing too is that, like I said, some people are not incredibly ill. There are people that can still work that have Lyme disease. There are people that can still function. I'm sure that there are people, I think Alec Baldwin has Lyme disease, and he says that it kind of ebbs and flows. I doubt it, but if he says that he has it, then he has it. But he's fully functional. He's working. He's doing his thing. I don't know. I don't know what to tell you. So somebody like him is not going to have the same level of sympathy and empathy as somebody that's very, very sick and disabled by this illness. He probably thinks that that's what Lyme disease is. He just gets tired every now and then. And yeah, I guess it could manifest that way in some people. But the other thing about Lyme disease that I've noticed is that and I've described it, as the illness du jour. It's the illness of the day. It's the illness of our time. It's the incurable condition that people want to have, where there's no concrete diagnosis, but they can say, I have it, right? And I know someone, I want to say in the family, that is like this. She has never gotten a proper diagnosis. I don't think she's ever seen even a Lyme literate physician. She goes to chiros, a lot of that. She's an anti-vaxxer, conspiracy theorist, all of that. And she's said for years that she has Lyme disease and she's got Lyme disease, but her life is pretty normal, to be honest. She can eat whatever she wants. She has a normal social life. Yeah, she's, maybe overweight. She's an older lady. She's going to have all of the, aches and pains of aging. But whenever I see her at a family function, I mean, she makes a beeline for me, and she's just, got to talk about the Lyme disease. And I think for some people, like I said, maybe for some people that have psychological issues, or that are trying to explain their physical condition, trying to explain it away, Lyme disease has become the go-to illness because it's incurable and difficult to diagnose, and they believe you just don't need a positive test in order to get diagnosed with it. You don't even need to see a doctor. I can just say that I have it. And that is problematic. And I'm not saying that it is easy to diagnose. A lot of people come back negative, but there are doctors, physicians that are trained to diagnose it, to give you a clinical diagnosis. And they can run other types of blood work to see if there's something going on. But a lot of these people just hijack this illness because they think, well, that's just how it's diagnosed. You just say that you have it, and a doctor just tells you you have it. So it becomes this weird, it's become almost a fad illness, and that really bothers me because those of us that are really, really sick with it, that's why we're called liars. That's why we're called fakers, because there are a lot of people that, take it and say stuff like that it's a spiritual experience or it's a gift or whatever. People have died from Lyme disease. People die from it. Nobody's going to say the same thing about AIDS, right? This girl would not have dared to say that about AIDS. So why say that about Lyme disease? That people have died from Lyme disease. People are permanently disabled. People have, I'm permanently disfigured. I have scarring on my face from it. I have scars on my chest from a tube that I had in my neck. I'm underweight. I could die if I get some kind of other illness on top of this because I have no protection. I'm so thin, and so malnourished. It's just so insulting and so disrespectful to people with this illness, people that are really suffering from this thing. And like I said, we're all at different stages. Some people have it well managed with diet, with lifestyle, and good for them. They might have been one of the lucky ones, but a lot of us aren't. And those of us who, and the reason these people are often heard is because they're fine. They're able to speak. They're healthy enough or still able enough to speak and be loud and be heard. And unfortunately, those are the voices that are heard. And those of us who are really sick and who are stuck at home are not heard. And, that's the tough thing. That's the tough part of Lyme disease, is that those of us who, who are the reason we need a cure, we need some kind of treatment, we're not visible because we're so disabled that some of us are bedbound, some of us are homebound, some of us can't really go out much. And so people say, well, Lyme disease really isn't that bad, right? And that's why people feel that they can say this kind of nonsense about it. But yeah, I have not gone back to any of the support group meetings. I try to stay out of the Facebook groups. I used to donate. You can do that donating thing through Amazon where part of your purchases go to like LymeDisease.org or whatever. And I stopped doing that. I was like, you know what? I don't want to support this because this is a complex illness. And I'm not saying that antibiotics won't help you. I'm not saying that homeopathic or herbal medicine is not going to help you. But it is not a one-size-fits-all situation. And you guys have seen from my videos how much I've struggled to find some kind of treatment. And even the treatments that have worked have only helped me maybe like 30% or 35%, which is still a godsend for some of us who are in really bad shape. And I wasn't too worked up by this video because I've heard stupidities like this before. I had a lady when I used to live, when I was married and we lived in this apartment complex, there was a lady that was one of these, Bible thumpers. Every time she saw me, she would tell me just to, just put your hands together and pray the Lyme away. And I was just like, thank you, ma'am. You try to be polite and you try to understand people's ignorance. But when it comes to influencers, I know that they're trying to get attention. They're trying to get clout off of making these videos. They know that they're going to upset people and they don't care because the only thing it's going to do is get attention and it's going to circulate on the internet and people like me are going to make videos about it. And they're going to get more and more attention. But, I wanted to give my perspective on it because I didn't really, I was like, I shouldn't even make a video about it because people say stupid things all the time. But because it was so specific to Lyme disease and because neither one of these ladies said, I have Lyme or I'm suffering from it, I was like, who are these people? Why are they even talking about it? Is a podcast about Lyme disease, or is it just two random ladies saying, dumb things? So I did want to address it, and I'm pretty sure some of you have seen it. If you're on social media, you've seen the video, and you're probably like, I wonder if she's gonna say anything about it. But I've met people like that. I've met people like that within the Lyme disease community. That believe in all this woo-woo stuff, and yeah, that's great if it's helped you. That's fine, but we have to recognize that this is not a one-size-fits-all disease. It affects some of us very, very, very severely, to the point where there are very few options for treatment. And it's happened to me even in the exosomes groups, in the stem cell groups. They're just like, well, you should have done this, 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 and this. And it's like, you do realize that we're two different bodies, that our illnesses are affecting us differently. Even if we have some similar symptoms, it's affecting us differently, and we have different genetics. This is not, you might have done ozone and hyperbarics. I might get sick, and I have seen people that get sick from ozone and from hyperbarics. I actually just recently had somebody tell me that they had ivermectin toxicity. And we hear a lot about ivermectin these days. So, I wanted to talk about it and just clear it up. Those two ladies are stupid. They're idiots. Can you learn things from your experience with this disease? Yeah, but I would do anything to not have it. I don't care how much I've learned from it. I don't care how much more empathetic it has made me. It is such a horrible disease that I wouldn't wish it on even my worst enemy. So anyways, that's what I've got for you guys today. Please like and subscribe, and I'll see you in the next one.